money getting spun. Like what? Like a coach bag, baby, this ain't what you want. If I ask for all I wanna hear is yes. Shorty said she wanna be my op, God bless. Look, I ain't even got dressed. Any L that I took come after YS, so man. Baby, here we go again. Real fat, probably got a double chin. First day.
What's up? Welcome back to the crazy but exciting show of the BCC podcast with yours truly, Buffy, and of course my co-host, Coach Chemo. And we would like to thank you for following us on our social media platforms, on Instagram, checking out our YouTube full episodes, and following us on TikTok for all of our latest and greatest episodes that we record. But tonight we have a special guest with us who will be shortly introducing herself, and we have a great topic that everybody's going to be engaged in. And make sure you get your popcorn and your tea or your Tito's, whatever you want to get yourself comfortable, because this is a topic you guys want to tune into and not miss any details. So I'm going to...
This is the topic that tells you how to properly pop your coochie without popping it out. So pull on up and let's get ready to ride. I will go ahead and I would like to take the moment to introduce a very lovely additional dear friend of mine. Yay to all my Black female friends. I want y'all to see that I only fuck with pretty bitches. So yes, this is my dear friend and MD alike, Miss Dr. Bernice, but I like to call her Dr. D, and the D does stand for dick. Yeah! So without further ado, come on, Dr. D, announce yourself, introduce yourself to the people.
Hi, everyone. So my name's Bernice. As Coach Chemo said, I'm a nurse practitioner. Met Coach Chemo many years ago in practice, and it became a friendship. So I worked in infectious disease. I'm currently a PhD candidate as well. So just have my hands in so many different things, like many Black women do. So yeah.
And tell us about, thank you. And tell us about that lovely background. Is that a background? Is that a poster? I see my mother on there. I see my mother of the house, Beyonce, on there. I think I see Harriet Tubman. I see Oprah. I don't know those other old ladies. Who are those old ladies, Monique? You said you know who they are?
Don't disrespect the legacy now. We got the Shirley Chisholm, the Harriet Tubman. I mean, I love the background. It's just giving women history, Black power. I love it. So why did you choose that background for tonight?
Yeah, so this is my Zoom and virtual background. I created it just as a Black woman in the space of academia, in healthcare, in the world. I feel like as Black women, we get so much slack and sometimes we lose ourselves in the process. So this is my wall. I call it my wall of giants. All the Black women who've come before me, who are alongside me, whether that's in real time, like the Beyoncés, the Oprahs of the world, who are just inspirational in just a number of different ways. You know, feminism gets really a bad rep nowadays, but I am a diehard feminist. I am all for women's rights. And so these women, I feel embody that in just a number of different ways. And so that's my wall of giants I created.
Beautiful. And we have to honor our Black women, our ancestors. You know, this is honoring you guys. We could not be here if it wasn't for you. So we're going to continue to work and empower our legacy to continue to keep that torch going. So we are glad that you're here and honored for your background.
Absolutely. One of the way we like to kick off the shows is we always like to do our highs and lows of the day. Just to take a check of the temperature, see how our day is, take a check of ourselves. So my high for today and my low for today. My low for today was that I did not maintain my time management as much as I possibly could. I was very effective in getting through my task and then getting them completed. But unfortunately, I had a few people like Pusha T that stepped in throughout the day and they ate up a lot of my time. And that I wasn't so pleased about because that was time that I worked really hard to squeeze out for myself. And then they came and took it up. The positive was I got so exhausted that I took a day nap. And as a person over 30, oh, day naps has become my new favorite thing.
Yeah, absolutely.
A
Absolutely.
good 45 minutes and I feel refreshed. I feel like I want to help, I want to end childhood hunger just for that first 15 minutes afterwards. I just feel so positive afterwards. For you, Buffy,
Absolutely.
what was your highs and lows?
Well, my highs is always to me, we're living in a crazy world now, and we got through the earthquake and we got through the eclipse, and every day is not promised. So I just thank God. Like, that's my highest of the high of every day. It's just thanking God, diving more into prayer, actually keeping myself and my family and good friends covered under the blood and under the prayer of Jesus Christ that I believe in. I don't know what anybody else believe in, and please don't take my statement as an offense. This is just my belief, so this is my high. So that was my greatest moment of just waking up and getting another chance of doing something different for today. My low, I would say, was engaging in conversation that I had no business engaging in. And I'm learning to disengage myself when it comes to things that's going to lower my vibration. So once I see these type of things that's coming across me, I'm learning now to kind of dismiss myself, just not engage in it anymore, and just putting like a hard pass onto it. So that was my low for today. What about you, Dr. B?
Yeah, so my high, similar to you, just waking up, having the ability to show up another day and do the things, all the things. And I guess the low is all the things. Just having a lot on my schedule right now. So definitely a low. Like every time I'm like, okay, I checked one thing off the list. There was something I forgot to put on the list. So it's
Yeah.
like it's just replaced by something else. But I'm grateful for the ability to still be able to do what I do, to still have the passions to do what I do. And like so, it's a privilege. I take it with grace.
Yes, absolutely.
And that brings us to tonight's topic of conversation. And tonight's topic of conversation is what are some tips for first dates or certain things to take into consideration for a first date? And to give a little bit of context, I met you, Dr. D, right after a first date went badly awry, and I needed some very strong, sane medical advice. So I figure, how well can we, elaborate on that today? So I've been talking to myself, talking to a few other friends of mine, male, females alike. And these are questions that we all have, whether you're gay, bisexual, transgender, questioning, or unless you're asexual, then you don't have any of these problems at all because you're just home. Because then you're just home. But let's say safety, right now safety has been a real concern when it's considering with dating or hooking up. So what is safety first and foremost? Because I think we've had a hard time defining safety. Where for some people, let's say use of a condom versus not use of a condom versus being on prep versus not being on prep versus being at my place versus your place. How do we develop good safety practice that is individual contextualized to us, but then is also able to be not changed or molded, but I guess interact with other people, methods of safety.
Yeah, so I think that's a good question because I think oftentimes from a clinical standpoint, when we talk about safety, it's all like the risk, the risk, the risk. And I think we inadvertently create a lot of anxiety around sex and just fun and just living life because we hyper focus on the risk. I like to more so talk to people more about pleasure and what does that mean to you. So I think part of safety is taking someone's entire personhood into consideration. So having pleasurable, non-anxiety provoking sex is part of the safety strategy. So when I have these conversations, it's not about, oh, do this to avoid getting HIV or avoid getting an STI. It's, oh, what are some things you can do to have fun, pleasurable experiences without all the worry? And that might include wearing a condom. So afterwards, you're not in bed about to do a backflip because you're like, you know what? He might have had something. I'm not sure what's going on with other stuff. You're chilling. You're enjoying the moment, doing whatever it is that you do. So I think when we talk about safety, we need to kind of reframe it and talk about, okay, what do you need to have fun, to feel comfortable, and to have pleasure? And what does that look like for you? And what does that not look like for you?
And let me throw a caveat into that conversation. I feel like I've been dating a lot of hood niggas, right? But in my head, I want me a gentleman, you know? I want me a nice glucose guardian that is going to be able to supply all my glucose needs. So I'm not going to be applying the same pleasure to the different people, right? My pleasure scope is going to change, right? Because this person is going to be able to afford all the pleasures in the world, while this person might not. They're going to be looking for me to provide them pleasure in terms of covering their meal after they get together. And that no longer makes me pleasurable, nor does it make me feel safe.
So then, I mean, I would probably want to know then, if it's not making you have pleasure, it's not making you feel sane, then what is it about those interactions that's enticing to you? And that's
It's
something
what you said
that can be addressed on an individual basis.
It's what you said before. It's the risk. I saw the body. I saw the height. They had good edges. They look good. Like they could, throw it down in bed. So I'm here for the risk.
I mean, every day we're making, we're balancing things like, we're doing like a risk to benefits analysis with everything, whether that's speeding, whether it's, we're going to run the risk of taking that light. Not saying I do that. I drive safely, but we're doing a whole bunch of different risk to benefit analysis. And I mean, those are things that needs to be handled on an individual basis, because I'm never one to like tell people what to do versus, what you call quote unquote hood niggas are not for me. But I can
I know that's right.
I can appreciate someone saying, hey, this is what a person of that caliber brings to the table for me. And yeah, my edges may be snatched, but I got the drip to figure out how to regrow them. And then, hey, by all means, my hair does not grow at that capacity, and to each their own.
Yeah. See, Buffy, if we need edges, we can't be messing with hood niggas.
I mean, I'm not do what you do.
I'm about to say, she didn't say that. Okay. She said you got to just take precautions. She didn't say we couldn't deal with hood niggas. She said we have to figure out what pleasures us. Everybody's pleasure looks different. But hood niggas, this is a message for you. Please be safe, because we like messing with y'all. Because y'all always come with what we're looking for, okay? So I need for you to go ahead and see Dr. B, go run the tests just to make sure you're good, because we like messing with y'all. But
by we, she means them, and comes to me.
Not Dr. B.
Just to clarify.
Dr. B, we hear you loud and clear, sis. We know that you don't want to get involved. We know you don't want to get involved with them. But like, but I think it was very interesting what you said. Like, you talk, like, what is the like age range of folks that you talk to and actually do, because you do consulting. Like, I'm sorry, I didn't get the clarification exactly. Like, when you have these conversations, when do these conversations actually stir up? Like,
population that you treat.
Yeah, so as a clinician, I see adults. I can see pediatrics too, but I don't practice in the pediatric space. So I see primarily 18 and older in infectious disease and addiction medicine. But as a emerging scholar, I do research around sexual reproductive health. So I have these conversations with communities for research purposes or just in general conversation. Most people that knows me know it's really hard to interact with me without some conversation around sexual reproductive health, women empowerment, and just living a life that's comfortable and allows you to thrive as a woman. That's usually where I center my efforts. So
Oh, I might need you in Richmond, because with the population I work with all these young women with multiple children, that's struggling, and it's sad to say the word struggle, but they're really struggling and they really don't know. Some of these children are from trauma, some of these children are from monogamous relationships, and some of them are just from the hood niggas. Like, they just intertwine with street life, and then they actually produce these children. So like, with a woman that has multiple children, like, how would you advise her to kind of slow down the reproduction of, producing more children if you don't have that capability of, caring for them?
Well, that's always a difficult balance, because now on social media, there's so much demonizing of the single mothers, the targeting of baby mamahood and all this nonsense. And I'm not one to really police people's reproductive choices, especially in a world where Roe v. Wade just was overturned. So my thing is, I like to have more conversations around, okay, what is the drive to having children? Is it something you want? Some people want big families, and although it could be economically taxing, that is the risk to benefit analysis that they're making. So I try to approach the conversation with the understanding that maybe they're making informed choices. And then now, if in that conversation it is unfortunately that they're not making informed choices, because Black women, for example, are disproportionately impacted by intimate partner violence, by reproductive coercion, by, all the narratives that tell us, oh, if we really love you, we're not going to use a condom. All these different things, if those are the narratives that are driving your decisions, then that is an opportunity to really educate and learn from each other and have more of a bi-directional learning opportunity to really shift the viewpoint, and also understand people's position in life, because we all on this call could be empowered. We got our own place, we work, we do our own thing. So if he gets crazy, we could go, but not everybody, that's a privilege. Some people have to be in certain relationship dynamics for shelter, for food, for survival. So you have to have space for that without the shaming and the stigma that could continue to keep people in really messed up situations.
Absolutely.
And going off that basis of stigma, what would you say, what action should an individual, now male or female, who has had an experience that they weren't necessarily comfortable with? You met someone, you went on a date, and it led to physical penetration. You had hoped to use protection, you didn't use protection for the steamy of the moment, and afterwards you kind of felt dirty. You kind of felt raped sometime, but you're not sure because you didn't say no, you didn't say yes, you just kept on going along with it. Just like you said, afterwards, you start to might have feel like you might have regretted it. What are some appropriate actions medically that I could take to help clear my nerve, help to balance the anxiety, or just, I guess I don't want to make this my new set of rules where every time I go out on a date, I'm now spinning the block to the ED. But what are some good, I guess, sexual preventative practices that you could offer or suggest for someone that might be going through that? So, I'm not a regular dater, but I'll date, once every 3 months, and because I haven't had anybody, so I end up sleeping with that person, but I didn't mean to, but my body kind of meant to. So, that version of things.
Right. Well, I mean, there's so much to unpack with that, because one, that whole, oh, you kind of feel like it was rape, but you're not sure. I think we need to do a lot of work around educating both women and men around the concept of consent. Explicit consent is necessary. People have a very odd comfortability with coercion. And if someone's just not saying no, that's not saying yes. And so I think there needs to be larger conversations around what consensual sex is, so we lessen those experiences where someone is there unsure about how consensual their experiences was. So that's first and foremost, and that's a whole different situation.
Mm-hmm.
Yeah, but to address your point around like, okay, you had an experience, you didn't use a condom at that time, so that, is an opportunity to use PEP, which is post-exposure prophylaxis, and that's addressing just HIV. And that you can get from your healthcare provider. You could use like PrEP Navigator, like to find PrEP providers who could prescribe it, or you could go to the emergency room. But of course, with the emergency room, there's going to be increased costs, insurance, and things like that. So ways to manage that outpatient is best. And you have 72 hours to get on that medication. So people compare it to the Plan B, just like you have 72 hours to make sure the baby ain't coming. Yeah, it's the same thing. You got 72 hours to make sure you're not about to get HIV. Now, some people will panic and like come to clinic and be like, oh my God, Bernice, I need to be tested for everything. Yesterday, I was with some dude and he's trifling. I saw him on Are We Dating the Same Dude? And all this other stuff. And I'm like, okay, slow down. Let's unpack some of these things, because if you met someone yesterday and had, or a week ago and had, unprotected sex, if I test you today, yeah, I might capture stuff from before that person, but we're not capturing any potential STI from that experience.
Right.
So understanding window periods is what we call them, which is the period of incubation before a test is going to be positive after an exposure to a STI is important. And so, that might be outside of the scope of this, but looking up window periods, like chlamydia, for example, is a 2-week one, like gonorrhea as well, like the bacterial infections, is important to know, so you're not wasting your time. I say all that to say I'm never going to discourage testing, because we should always know our status at every single point in time, before an encounter and after an encounter. So if you haven't been tested for a while, I'm still going to test you. But if it's because you had an experience with someone you're deeming to be trifling, is not going to help you today. So.
And during that window, is there any preventative measure? Can you just give me some antibiotics just in case, because we know he's trifling?
So you'll have mixed reviews on the antibiotic stuff. As an infectious disease clinician, I have concerns around like antibiotic resistance. So I am hesitant compared to other clinicians who may be less hesitant, who may have different information around, like you probably are seeing a lot of information around doxycycline post-exposure, similar to the HIV medication I told you about. So there has been a lot of data supporting that for men. Per usual, women aren't really in that conversation because we weren't in the trials. So will be thought about after, and data will come to support it for us. But for men, primarily MSM, they are saying that like doxy PEP post-exposure has been beneficial to reduce rates of the bacterial infection. So I will endorse that because that's what the science says. But depending on your clinician, there may be bigger conversations around like resistance and if it's appropriate for you at that specific time.
Okay. And then similar to some of those advice that you already provided, are those male specific, or are those males and female for even like the 72-hour window to jump on? Can females now join that group, or they're still X'd out?
No, women absolutely can take PrEP, which is pre-exposure. which that's my work that I do, that I really encourage Black women in particular, especially if you're dating in these EHE priority, ending the HIV epidemic priority jurisdictions. So Maryland has 3, Baltimore City, PG County, Montgomery County are in higher incidences and cases of HIV. So if you're dating in these areas, DC, the New Yorks, or just, you're out here, you're having fun, I personally find PrEP to be an empowerment tool. Why not take a medication, a pill, an injection, where you can know, okay, you're 99% protected from HIV. That's one less worry off your plate. Assuming you don't have any medical condition that doesn't allow you to take these medications. So that is for men and women. When PrEP first came out, there was a lot of advertising for gay men, and there was a lot of focus for gay men because they're disproportionately impacted by the HIV epidemic, but so are Black women. So we have to do the work to get the message out there that this is also for Black women. You can take this medication as well, for preventing HIV.
Okay.
Nice.
So one of the questions that I was telling someone that
Wait,
I was
I'm sorry.
talking to
I had to ask one question. So, can you
Go
just
ahead.
tell like the audience where can you get the medication? You said they have to find like a local healthcare provider to provide that to them, or is there any like website that they could go on and actually, because like how some medication give like free trials. Can you elaborate a little bit on that?
Yeah, so you could find, I'm pulling up the site, is like preplocator.org. So you could do that, put in your zip code, and it will find a provider in the area that does PrEP. Granted, it is a preventative medication. So your OBGYN, your primary care provider, your pediatrician, all of them should be able to prescribe PrEP. Now, do they all, like, if I'm going to be realistic about the systems and, the work we need to do to get all my colleagues on board? No. So the easiest for sure way to know you're going to be able to get PrEP is to go to a PrEP provider or to your health department as well. Usually there's providers in collaboration with the health departments that are going to be able to get you on PrEP. Prior to starting PrEP, there's just some lab work that needs to be done to make sure, there's not like kidney dysfunction and things like that, and make sure you're HIV negative at the time. But yes, so those are the main things. And as far as cost really shouldn't be a barrier. It is an expensive medication, but the insurance covers it as a preventative approach. The pharmaceutical companies have support to get people covered, whether it's to cover your deductible, if you have a high deductible, or to cover out-of-pocket costs for the medication. So you could work very closely with either a PrEP navigator, who help, navigate all the nuances in the systems to get you on PrEP, or your provider to make sure that you could get on PrEP. And my DMs are always open, especially when it's about PrEP. However, I could help facilitate connecting people. I'm always happy to do that.
Awesome. I'm glad to know that. Yeah. And so, audience, if you hear that, just in case you might have a little slip up, hopefully you don't. But this is the information that is good for you to know, or pass to anyone that you might know that might need this information. So thank you, Dr. B. Appreciate that.
Absolutely. Thank you. And my follow-up question I was going to ask was, I was telling someone that you're going to be on today, Dr. D, and they wanted me to ask you, like, in your line of work, how much is too much and how much is too much? You have to ask all those questions to screen how much people I slept with since the last time you've seen me. What's too much? Is it 3 within 3 months, 6 within 3 months, 10 within 3? What's the point where you're like, okay, you want to pull some numbers back? You want to pump the cards?
That's a busy person. You said 6 and 3 months. Good Lord. That's a lot of people.
Yeah,
it's 6 and 3 months. That's 2 person a month. That's every other week, a different person. And that's on the medium scale. Like, go ahead, doctor.
Medium. Lord. All right, go ahead.
So yeah, I mean, I'm not here. I never shame contact because my thing is we ask those questions more so just to really get more information. So screenings is about data collection, just to kind of get to know you. I actually just wrote a paper about, moving beyond like a risk focused standpoint to a more reasons focused standpoint. Because to me, and in my experience, you could have someone who has slept with 10 people in the last month, but they know those people's HIV status. They're sharing their STI statuses using their MyChart. They're using condoms with those 10 people versus you have a woman who's in a relationship with a man who she thinks is monogamous. He's cheating on her. Karen just had his side baby. So clearly he's having unprotected sex because the baby is evidence of that. She is technically, if we're going to be talking about risk, at higher risk. I hate the word risk, but she's more vulnerable to HIV because she doesn't know her partner's cheating, or she's not able to be empowered enough to negotiate condom usage with him. And he's clearly having unprotected sex with other people, and she's unprotected herself, and she doesn't know his status. So it's not about the quote unquote body count. It's about the nuances within those experiences that matter. So I don't subscribe
So
to.
you can so you can be 10 and golden, and that one bad apple that you got could fuck the whole shit up.
Yeah,
Pretty much.
yeah. It's about the nuances within those interactions, and
Yeah.
not about the number of the pot of the interactions.
And then the
Okay.
crazy part about it that I never understood, everybody lives their life, right? And there's gays, there's bisexuals, there's lesbians, there's heterosexuals, but it's the bisexual that's messing with men and then messing with women unprotected. And then, that's how the diseases and the longevity of high risk continues, because it's like they don't want to use protection because it just feels good. So have you ever had like a patient that came in and said, I'm bisexual, I love men and I love women, but sometimes I don't know if I'm getting it, I might got an infection from this woman, I don't know, I'm not sure because I'm doing unprotected sex with both of them, with both parties. Like, how would you address that person?
Right. And so like that's a complicated situation because we have done a lot of work perpetuating misinformation. So a lot of Black women will say exactly what you said. Like when I talk to them about their risk for HIV, because they're in my office crying about their man having another side chick and another side baby. And this is the third side baby I'm hearing about. And I'm like, girl, why are
And
you
he's still living?
Yep. And I'm like, why are you not on PrEP? Why aren't you trying to prevent HIV? They're like, oh, well, he's not DL. He's not messing with men. He's not this. So we have hyper focused on HIV being a risk factor driven by bisexual behavior or DL culture. And that is, that's not the truth. It's, gay men are disproportionately impacted by HIV, but that does not mean they're the drivers of HIV within heterosexual interactions. So that's one thing that like a lot of people don't care to be on PrEP or don't want to be on PrEP because they're focused on that, or if they get something, they're thinking their man's DL when really he was just with Shamika and all of them that you was crying about last week. But because we have levels of like, I would say system created homophobia that have driven these messages, it creates disinformation and misinformation that don't allow people to get the care that they need. Now, have I had DL situations or people talk to me about, being bisexual, which is different than being DL. So they're bisexual, they date both sexes. I talk to them just like I talk to everybody else. Hey, you should be getting tested. you should have your partners get tested. Don't take paperwork for test results. Have them log in, watch the login. You don't need the screenshot.
Yeah.
Watch them log in to their mic card and verify information. And people be like, oh, your partners aren't doing all that. Then my question is, do you feel safe to have a pleasurable experience with someone who can't log into a MyChart? Yeah, if you do, then by all means. But if you don't, then that may make you make different decisions as far as engaging with that person, or you might still engage with them, but you're like, you know what, let me get on that prep because I'm still gonna pop it, but let me be safe. So it all depends on the situation.
Right. And so I never heard of that, the medication PrEP. And I'm sure it has like side effects because you said they should be getting testing just for kidney functions and things of that nature. But gosh, that is such a deep, intervention that you have to have with these patients on a day-to-day because, folks are really out here just doing whatever because they feel like it just feels good and they like them, and because they're cute or she's cute, they come with nothing, and sometimes they're coming with a lot that will destroy your whole life. So folks, make sure you are taking notes to this because this is really important and is actually destroying our culture, our Black community, with these sexual diseases that's actually circulating in the population. So, please hear it clearly and loudly that, you guys got to protect yourself when you're out there.
Yeah. And I want to just clarify, as far as the side effects, there are, every medication has side effects. Food has side effects. That's why we're all unbigging our backs.
Girl, listen, 2024 gonna get whatever back I got to serve.
It is given. I'm going to be giving medium back. Yes, medium back. I'm not a big back. I don't claim big back, but I'll be giving medium back.
Yeah, I have a medium back myself, so I'm So when we talk about side effects, there's side effects to any and everything. So there's precautions, there's testing that we do just for screening purposes for over the time period that someone's on PrEP. But the studies have shown the medication's very tolerable. I don't think I've only had one patient had just abdominal upset stomach with PrEP, and then that went away within 2 months of it. And you could address the little discomforts. I haven't had anyone in the years I've been doing this have any adverse effects on PrEP, and we monitor fairly closely as well. So, people have concerns and anxieties around taking medication, which is understandable, but I don't want the term side effects to be a form of that's going to be a deterrent to people taking or choosing a medication that may be significantly beneficial for them. So it's case by case basis.
Right.
One of the things that I've been experiencing, and you brought up the word deterrence, I've been seeing people using the benefits of the drugs we're discussing and using it as deterrence. Like I had a gentleman said to me one time that, if you're taking PrEP, that's because you're a whore and you want to be a whore. So you're taking PrEP in order to be a whore. And I was like, what? Taking PrEP helps you that if you have these experiences, that you protect yourself and you're safe. You can't control what other people do, but you can control this one portion or this one aspect of you. Have you come across those kind of people that have those kind of slight perception as well?
Right. Yeah. The whole Truvada whore stigma has been a problem since PrEP was first approved in 2012. It is unfortunate that people do try to shame people who are empowering themselves in that way to make sure they're safe by labeling them a whore. It's the same thing as when women carry condoms. The assumption is, oh, she's fast, she knew what she was like. No, she's just preparing for all scenarios, and we're sexual beings. and she's being strategic and smart. So why do we have to like shame these things?
True.
Can you repeat that again? And can you start at the part where you said she's preparing for all things? And the reason why, I recently had a friend who told me, I have the Robins! And I wasn't sure how to respond, but she was like, bitch, I got the rubber. So I want you to repeat what you said so I understand what she was trying to tell me, that she's prepped and prepared for anything. So go ahead.
Yeah, I mean,
Sounds like a smart girl to me.
Exactly. It's like in every other aspect of life, when someone's prepared, we embrace that. We say, oh my God, she's strategic. She's moving smart. She's, has all her ducks in a row. But for some reason, when it comes to sex, I think a lot of it comes from religious shame, to preemptively think you're going to have sex outside of wedlock. I think there's a shame element to that. So everything needs to be spontaneous and spicy, and you just need to be thrown into situations. And no, like it doesn't need to be this roller coaster of life and the ups and downs, like having condoms with you. Cause hey, I might meet someone and feel so compelled to have sex. Like there's nothing wrong with that. It's worse when you're like now having to drive to CVS. CVS is closed, or you live in Baltimore City in the hood and they got the pin all on the condoms, and you gotta now you're embarrassed because you don't want to call them, and it announces it over the loudspeaker. And
oh
now
my God!
Out the store. It's like, why not
condom check on aisle 11?
They got, I saw her on the Hopkins website, and she's in aisle 4 trying to get, lifestyle. She didn't even get a Magnum. Like all this judgment that goes into people's behaviors. It's like, why not be able to prepare ahead of time? Like it just makes no sense. It just speaks to how backwards we are when it comes to sex, how we have so much work to do to move to a more sex positive world. Because at the end of the day, people are going to be having sex. People are going to be doing all kinds of things for pleasure, for fun, for whatever. It's never going to stop. So why not create experiences for people that's safe, that's pleasurable, that's fun, and that centers their needs without being popped and panicked every 30 calendar days? It makes no sense.
And I think for me, that's where it's been. I've been in the state of the panic, so I decided I no longer wanted to be panicked, so I stepped out of the game. I just left the streets. I left the streets for other people. But you've made it sound so doable that I think I want to go back. I want to get all my levels right. I want to make sure that I have my white picket fence up. Electric fence. I want to have my white picket fence up, my electric fence up. No hood niggas. Sorry. Tired. Did that trial. I want to keep my little bit of lace front edges that I got left. But I think summer is about to come out. So I think I might want to spend the block.
Have fun, be safe. That's all you can do.
Yeah.
I'm going to call that friend and see if she got any condoms she can send my way and be like, hey, friend. Next time she said, oh, I got my rubbers, I'm going to be like, friend, you got any for me?
Yeah, the prepared one. Exactly.
Any extras?
Yeah, if you buy the big pack, it's cheaper. If you buy the bigger pack, it's cheaper. Yeah. You guys got to get it.
Yeah, or get it for free at your provider's office. We carry condoms, all the fun ones, the glow in the dark, the ribbed ones, all of that. Go see your providers and get it. Go to your health department. They have plenty of free condoms.
And do those work? What if I'm a big guy? Do those free condoms work that you give out?
Now, you know what? You have been dealing with the hood. Because let me tell you guys about this whole it don't fit. I don't have something with me right now, but literally my whole leg could go into the condom.
Yeah.
So, let's stop the madness. Let's stop the madness. We know what the average penis size is.
Right.
No.
What's that? What's that? Is that 10 inches? Is that the average size?
No. It's closer to 4 to 5.
Right.
So not everyone out here is a mandingo, and even the mandingos could fit a condom, a regular condom, not even a Magnum. It might be a little bit tighter, and could restrict a little bit of blood flow. But then you get a Magnum. But that's not the majority of these men. And stop letting these men put on these Magnums that don't fit them, hanging like a garbage bag, because it's gonna come on. You're gonna have to.
Where's the bell? I need a bell for that.
I just have to say, you're gonna have to fish it out of you, and then you're exposed, and then you're panicked because you don't know what went in, what went out, and stuff. Stop with the garbage bag condoms. Just get what fits you. You don't need the black and gold. Stop it.
Stop it. No, that's.
But I thought so. I thought that the black and gold meant you had premium dick, so you was giving out premium dick. But with garbage, that's what you're saying. You're calling it garbage bag condoms. It's no longer premium dick.
I'm calling it garbage bag condoms for the ones that don't fit. So it's saggy and it comes off. And size does not make, I mean, I don't know what your metrics of premium is, but size does not necessarily equate to good, because let these men tell it they all got mandingos and we still have an orgasm gap. So
where's that damn bell? Like, she's just hitting it. Like,
no, seriously.
Dr. B is hitting every
size.
Listen,
Dr. B is hitting the spot.
She's just hitting the spot. Like, seriously, like the oversized condoms, like, okay, because women always say, well, if you got a Magnum, then you're my type of guy. But like you said, you could have that type of size and just don't know how to operate it. And it's okay. It all takes time, but just living your truth. And that's what Dr. B is saying. She's not doubting you guys. She's not trying to diss you, but please live in your truth, because it is hard. I've heard horror stories where women had to, swim for the condoms out of them because it got lost. Right. Because it just didn't fit. So I don't think she's saying anything wrong.
So that's how it be coming off. See, I never had those experiences. So I was always curious, like, how do you miss a condom being on you to it not being on you? Like, how do you just not feel the differential?
Well, you do feel the difference.
You do feel it.
It feels so amazing that you go to now create a non-consensual experience for someone by continuing to have sex and say, oops, I didn't know, but you did know. And again, this is why we need to have conversations around consent, because that is non-consensual. That's considered stealthing. So removing the condom, whether intentionally, unintentionally, if someone consented to protected sex, and at some point in time, whether accidentally or not, the sex became unprotected, you are responsible to let that person know, and to regain consent in that experience. So,
yeah, absolutely.
And just to back up a little bit more, because I've been hearing that more now. So, of your experience, how much, and we can do a comparison now, how much female versus male, gay or not, do you see saying that they're not being pleasured from their experiences or faking the pleasure? Because for me now, as of late, I'm pleasurable surprised of how much heterosexual female I've heard that saying that they haven't orgasm or a guy haven't made them orgasm. And I'm like, so what y'all been doing over here for 10, 15, 20 years? Like, y'all just giving out free pussy, no cum, no nothing, and we high five? Like,
well, I mean, I think it just speaks to the larger society. I'm going to get in my feminism bag with patriarchy that tells women that, hey, sex is something you give to men. You have to learn how to perform. You need to take all the penis writing classes. When have y'all ever seen a man take a stroke class? I don't even know if there's a stroke class out there, but we're here with knee pads on, learning how to ride, learning how to arch our back, all of the things. And I think that's what society tells us, that we need to perform. This is something we give men. This is something that's owed to men. So when women aren't getting the satisfaction or, you know, the pleasure. And pleasure doesn't always have to be orgasm. Like some women like intimacy, some women like that connection. So orgasms aren't always going to be the measure of like a pleasurable experience. But you should not be left feeling like you're wanting more and couldn't get more because the person just turned over and is snoring because they're satisfied in 2 seconds. Like it's just like, and there is such a thing as sexual incompatibility. Like we could work and grow and learn together, but just like there's compatibilities in communication styles, friendship styles, what's okay, what's not okay, there's incompatibilities in the bedroom as well, especially when someone doesn't want to grow or learn or prioritize you. It should be 2 people coming together looking to please each other and have fun.
Well, it sounds like I need to go back to my Build-A-Bear nigga, re-update all my characteristics that's needed, because it looked like I had mine updated with the 2019 version, and I need to update them with the 2024 version. Because all these T's you just dropped, honey, Buffy, we need to make sure that this year, anybody that we talk to, they have global entry. And they have global entry because that means that they can clear a background check.
Yes.
Number 2, we need to make sure that they have my chart. We need to see what your window of incubation has been since the last time you tested.
Yes. And we need year up to date. I don't want to see you logging in and it says 2018. Like we're in 2024. Correct. I need you to be on your annual visits, okay?
Correct. Mm-hmm. So anything you want to ask Dr. D before we leave, Buffy?
I'm sorry? I didn't hear you.
I was asking, is there anything you want to ask Dr. D before we wrap up?
No, I think you dropped so many great gems, especially I got to ring the bell again. The condom size, guys. Get your condom size. No, I think this conversation was absolutely great, and I appreciate your expertise and just all of the facts and tricks and tips that you gave the audience tonight. We appreciate that. So, no, I don't have any questions for you.
Okay, and I want to again express my dearest thank you for you joining us today. And again, I like to consider myself a very well-informed person, in between both. But every time I have this conversation with you, I'm like, damn, I know nothing. I need to go learn a little bit more. So this is just one of those refreshing moments, and let me know that there's always options. And like you said, it's not for the purpose of stigma, but it's for the purpose of how do we acquire the pleasure that we want and acquire it in a safe manner. And that, for me, a lot of these things that I've explored was always in the name and in the make of safety. Ensuring and maintaining that I was safe as best as possible. I can't control the environment. I can't control the other people, but I can at least control the actions that I take, whether before, during, or after. So for that, as always, I want to say thank you for joining us. And I hope you'll join us back again soon.
Yes, absolutely. Thank you so much for the experience. It was fun. I'm glad we were able to just talk so lightheartedly about, all things sex, pleasure, fun, dating. And yeah, my last parting words for the audience is to just have fun. And fun does not need to be reckless. Fun does not need to be vanilla. It just needs to center your needs and your priorities and your safety. And then, what better way to be able to bust it open freely is to know that you're protected. So see your provider about some prep, have your condoms in your bag. Ladies, don't shame the female condom. Pop it in before you go out. That way you don't even have to worry about whether he has a condom or not. Don't double up with the condoms, and just have fun.
Great. And okay. I think my take before we end is just learning how to have self-control. Do your due diligence of checking the My Chart and figuring out who you're sitting in front of and what they're about before you really open yourself to them. Because I really feel like even though it's a pleasurable and sex experience, that spiritual connection, that exchange is really deep. And you don't want to get intertwined into something that you really can't dig yourself out of, especially if it's life-threatening. So I would say just take it from this episode. Self-control is my take. Like, make sure you guys can just handle yourselves when it comes to the mating process.
Mm-hmm. Or like they say, stay ready so you don't got to get ready.
That part. Yes.
That is Buffy's motto, honey. That is Buffy's motto. Buffy, stay ready so you don't have to be ready, okay?
That's it. Yep. I say that all the time.
Yep.
Coach K, you want to leave the audience with your tips for tonight? Is there anything that you want to drop with them?
Honestly, I'm still trying to remember everything Dr. D told us, because as soon as tomorrow hits, I'm calling up my providers. I'm hitting the ground running because summer's around the corner. T-minus less than 30 days in Kelvin, and I plan to be outside this summer in poopum shorts and tank top.
I hear that. Well, off of that note, we would just like to thank everyone for watching this episode of the BCC podcast. You can see our episode, the full episode, on YouTube. Follow us on Instagram on the BCC Show 1, on TikTok, on Facebook. Please just go ahead and like and subscribe to our episodes, because we are putting all of the full episodes on YouTube, and we appreciate your time, your feedback, your comments, everything. We love you guys, and continue to follow us and watch our episodes. Until next time. Ciao.
Ciao.